Welcome. Welcome to your Joyful Riches podcast, where you gain precious tips and tools for creating a beautiful, joyful, thriving life, even if you are facing challenges and adversities. This podcast is delivered alongside with the International Childhood Cancer Charity, where we empower in additions to emotionally and physically heal disadvantaged children with cancer globally, one child at a time. And for this week, we are so thrilled and very honored to have Rebecca with us. Welcome, Rebecca. Would you care to share with our audience what is it that you do?
Yeah, thank you, Dr. Tan. It's nice to be here with you on this podcast and talking to the audience. We are Cancer Help Desk. We are a 501c3 nonprofit, and we are staffed with oncology nurses and PhD scientists that investigate each person's case that comes to us for help, whether it be an adult, a young adult, or a child dealing with cancer, families, caregivers, friends. Anyone dealing with a cancer diagnosis that really needs and wants to look for additional options for treatment. Our PhD scientists complement what goes on in the clinic. That's really important that we make that statement. We are not to circumvent anything that goes on in their care, but our organization is really here to help them develop an action plan and look for options that are most suitable for their situation and their condition.
Wow, that is really amazing. So let me understand this. Just clarify to help clarify with our audience as well. A lot of time we think when we have cancers, the number one is go find a good oncologist to the clinic, and then that should be like the only thing and everything you need. So you're saying that sometimes having additional informations out there that the clinic is not necessarily everything and only thing, that it might be possible for people to have even better care in additions to that.
You bring up a great point, Dr. Tan. The world of medicine is so large and there's so much that goes on. And, the majority of patients that are dealing with cancer are treated what we call in the community oncology practice. 80% of patients are treated in the community. When we talk about pediatric, you're more so talking about the specialty children's hospitals, which is a little bit different than what we see in the adult cancers. But with 80% of patients being cared for in the community setting and a limited amount of oncologists with a limited amount of time, there's just so much information. And so much information that we don't, and I'm sure you see this, that you don't digest when you've been told you have a cancer diagnosis. So, to only know what that one doctor has, available in their mind and in their practice may not be the only thing. And oftentimes we see that there are other things for patients that they haven't been told or that their doctor may not be aware of. I can give you some examples of that, but it's really important that we think that patients know all their options. And so our team is really dedicated to looking at that person's situation and exploring science, evidence-based, science to support what we're saying and do that research that honestly the oncologists oftentimes just don't have the time when they're seeing 30 to 50 patients a day.
And I hear you. At some point, I was that oncologist, and it's definitely you receive all this information and you try to swallow them as fast as you possibly able to, and like you said, yet it's a community practice and we are all individuals, so we're all unique, and even if it's just one thing different about you, it could make a whole huge difference in the treatment and the outcome. So that is so awesome. What motivates you to do this?
Well, me personally, I'll speak for myself, but I'll also speak for my team. But I personally have been affected by cancer in my family and my friends. I've lost very young friends to cancer. I've also lost, several family members to this disease. Most recently, lost my father-in-law 5 days before my husband and I got married. And my husband is also a stage 4 cancer survivor who was diagnosed at 37 years old. So I personally have no shortage of passion for helping patients identify the right testing and treatment opportunities. Our staff, our team, the founders of the organization, our CFO, Shelley Frisbee, she lost her husband to stage 4 melanoma as well. And then Deb, who is our chief patient officer, she's been an oncology nurse for 15 years, and she sees what goes on in the practice and the plethora of information and the needs that patients had, that she decided that her career really needed to move into something that she felt was more personal and the day-to-day, and that she could help patients in the moment where they, where they are, and decided to be a part of the nonprofit. So, we could go on of all the many of stories that motivate us, but every day there is a new story, a new motivation. So not hard to be motivated.
So that is wonderful. Would you care to share, just to give, because there are a lot of there are a lot of cancer organizations out there. Would you care to share with us, say, a journey of an individual who contacted you, say with a recurrence cancer? So what can they expect? What's the journey like? Sometimes when you are navigating, when someone navigating cancer, it's already kind of overwhelming, to say the least. It's like, here's your list of medication, here's your treatment schedule, here's your yanny, and you're like, here's the medication to take at home. And then you're like, and there are some of my clients, being a grief specialist, like, I don't know if I can handle one more thing. I don't know if I can talk to another person or organizations. So would you care to share with us what would be a journey like for somebody who connected with you?
Yeah, it's a good point also, Dr. Tan. There is so much that goes on and so much overwhelm, and we really like to see ourselves as that guide, and it's expertise. What I didn't share with you thus far is that I have a background of 23 years in cancer testing, alongside Deb, who has her experience in oncology nursing. Our PhD scientists, who are molecular biologists who have studied cancer. Our board members are world renowned. Some of them are world renowned in the field of oncology. And, it's our experience that helps provide that guidance, that sound evidence, clinically based information that we uniquely know how to navigate. And so we think that everybody kind of needs, just like they need that grief support, that they need that in the moment clinical expertise that can guide them through, the cancer diagnosis. So, you asked me about a situation, and one that's very near and dear to me is that we have a young little boy who was diagnosed with a brain tumor. He was actually located in the UK. And in the UK, this little individual, he was not going to be offered any systemic treatment for his brain tumor outside of surgery. And the family was told to take him home to keep him comfortable until he passed away. And being a little 7-year-old boy, the family member said, no way, no how, there's got to be more, there's got to be other options. And they reached out to a nonprofit like ours. Actually, it was some of our team. We were in another nonprofit before Cancer Help Desk. And we helped investigate his case. We looked for clinical trials that were most relevant to his, what we call genomic profile, or the tumor tissue profile of like the biology of what's going on with this little boy's cancer, and why does he have cancer, and what's driving it. And we looked for clinical trials most relevant to him and to his situation. We were able to identify a clinical trial at UCSF, UC San Francisco, and he has been treated there for the last year and doing very, very well. So taking somebody from no options to looking for options, we believe there's always something to look for. Or if we're talking recurrence, we have seen a lot of brain cancer patients, a lot of pancreatic cancer patients, ovarian, things that we often see with high recurrence. And those are the ones that we say, look, we're going to sit alongside you and come up with plan A, B, and C. Sometimes, what we call standard of care, general care is good enough. And sometimes it's the first best step to take. But knowing what your options are to what the next step would be and the next step would be is what's most important. So what we say, planning that survival guide, right? Looking at where am I going to go when something goes awry? And that's how we work. We work with our patients on that. Every patient has a different situation. They live in different locations. They have different family dynamics. There's a lot going on. And so we like to be that sound advice and guidance for those individuals.
That is so wonderful. Having a contingent plan, even if at this moment they're going to do is staying with the course that the primary oncologist has designed for them, and it's talking about the cancers being the well-being in general, having that contingent plan to be able to say, okay, if this doesn't work, it doesn't mean I lose hope. It means there is plan B and plan C and so forth and so on. And
Right.
that's really great, because being able to have hope in these kind of situations can keep us going, right? And
Yeah.
I love that. Now, does your when you do the research, you mentioned about research, does your research actually does your organizations actually guide people on what medications to do, or it is more you say, oh, you know what, there's a clinical trial here or there, and then what about if you go there? So in other words, do you like prescribe supplements, prescribe medications, or you kind of help direct people where to go?
Yeah, correct. We don't give medical advice, right? It's guidance and options and opportunities, just a presentation of information that may not have been put in front of their eyes. We don't prescribe anything. We will talk about supplementation when and where it applies, but it's always a discussion with their doctor. So I think you pose a really good question in the sense of how we work. And really, like you, Dr. Tan, we coach our patients. We coach them on how to take that information, digest it, and be able to talk about it with their physician. The medicine is practiced with their physician. And those are the best guides for them under their care. But a lot of times we're so overwhelmed with information, we don't know how to ask the right questions. Right. And chat GPT is this big thing now, right? But if you don't prompt it correctly, if you don't ask the right question, you're not going to get the right answers. You're not going to get the information you really need. And so we're serving as that human intervention of saying, here's the questions you should be asking. If you haven't been biomarker tested, ask your doctor about biomarker testing. Is testing right for you? What is available for me and where I'm at right now? And we really go through those questions on a person by person basis and guide them through that, and really even put those questions down for them on what to ask in the report that we provide.
And that is awesome. Yes, because a lot of time people just sometimes for the public, sometimes people don't even know that there are questions to ask. If we're not knowledgeable, then we just kind of take, okay, this is ABC, and then they really feel that's ABC, instead of saying, oh, if this nausea making me anxious,
Yeah,
maybe there's a different options. and
right.
and then even in that matter, it's that is lovely that you are, like you said, providing that human touch, whether it is asking the physicians or it is doing research. Because if you're doing putting in the Google or Chat GPT the wrong questions, you'll get some really interesting answer. And sometimes it's with the grief client, they're like, oh, I just put these things and then now I got really depressed. It's like, oh no.
Right. Yeah,
What did you
exactly.
put in again?
Yeah, exactly. And it's, it's human touch, right? It's the human voice, it's the human touch. And, I think we've lost a lot of that, during COVID, post COVID, of that human touch of talking to one another. There's a lot of texting going on, there's a lot of misinformation. And we really stand firm in our belief of saying it is the human guidance and trust and comfort. And I'm sure you deal with this in grief. It's, knowing that there's a voice and there's somebody that cares, to talk you through what's going on. And sometimes just being that sounding board is enough. Sometimes it's, just answering some questions. And sometimes we really have to get into the weeds, and really talk through options because they're really strategizing on what to do and what steps to take.
That is wonderful. Thank you so much for sharing us that. Now, you mentioned you are a 501(c)(3), which is a nonprofit organizations. And does that mean that every people who reach out to you, they will receive help regardless of their financial condition?
Yes, that is correct. We do not turn anybody away for any financial reasons whatsoever. Everybody that comes to us gets at least 2 hours of free consultation. And that is spending time with an oncology nurse. Sometimes it does include the PhD scientist. Not every case needs a PhD scientist involved. But at minimum, there's 2 hours of consultation. Sometimes we need to spend a lot more time investigating the case. And as you can imagine, we've got to pay our PhD scientists to do that research on a person by person. So we do charge a very minimum amount. But again, we do not charge for people who do not have the financial means to do it. So, it's just, kind of cover the cost, cover the time, pay it forward. That's really how we work.
That is very honorable. How do people connect with you?
People can find us on social media, on our website at www.cancerhelpdesk.org. We also have a phone line that people can call. It is 888-454-0804. They can find us now. We have a TikTok channel. We have a YouTube channel. We're on Facebook, on Instagram. They can learn about our services through social media if that's what they desire, or come to our website. Our website also has a scheduling assistant where they can schedule an appointment with us right there without having to talk with us first. So, excuse me, that links directly to our oncology nurse and their schedules. Excuse me.
That, bless you. And that is beautiful. That's awesome. And yes, I did got to the honor to and the delight to speak with your oncology nurse, and she is really lovely and friendly as well. So that's really great. And that is really awesome. And being a 501(c)(3, if somebody says that they want to, they believe in your cause and they would love to be able to support you, how do they get around? How do they do that?
Yes, great question. We do receive donations. We have donations online. And, that's the main way that we receive support. And yeah, I mean, we're always, as a nonprofit, that's what we're subjected to. We're kind philanthropists that are willing to support our initiative, and donors.
Super. That's great. So you can, if you want to support this beautiful cause, you can also go to the same website, cancerhelpdesk.org. And for people who are navigating cancer, adult or children at any stage, particularly those who say receiving bad news, sometimes that happens with in the journey with cancer. Do you have any 1 or 2 tips? How do people keep going on with that? How do what are some of your a tip that you can share when you just hear, you see that oncologist's face that make your heart sing is a lot of time what my client would say. Any tips that you have for people in navigating cancer?
I think, as anything in life, having a plan, right? Whether one of my latest analogies is you don't develop the escape route out of your house for when the house goes on fire, when the house is on fire. Having that plan, really can give you the confidence of how to get out. And so developing a plan, I think, is number one. And if you don't have the skills or the know-how to develop that plan, then there's people like us that are here to help with that. Number two, I think, I tell people to make sure you know what's going on, right? Get your medical records. One of the things, my background coming from testing, I tell everybody I know, get your laboratory, get your pathology test results, because that's what determines your care. We think that it's the oncologist who really determines our care. They determine the treatment based on the diagnosis. And so it's really important to get that information to develop that action plan. But everybody should have that information. And it's just not common because we don't see the laboratory, the pathologists, the laboratory professionals when we're going through care. And we don't know that that report exists. And so it's a really important puzzle piece to know. And that's the other piece. I tell people, have an action plan. Make sure you get your medical records, make sure you get that pathology report so that we can understand what's going on and that we can help you plan.
And having the right support if you don't know how to do that. Absolutely. Yeah. Yes, definitely. I always say it's and this is just even come from my clinical background. Just like experience, it's like, doctors, as much as some would think otherwise, doctors are not God. And doctors, and also the same thing when you have a test, when a lab doing something, it's possible to have lab error, not because anybody negligence. Machine is machine. And so doctor is not God, and even machine can make mistakes. And so have your information and kind of keep an eye on that. And so that is really great advice. Thank you so much. And as we complete these conversations, do you have a final message for our listener, our audience?
My final message for people is to make sure that you're talking to somebody, whether it be a grief counselor, organization like ours, somebody who can listen and hear your story and help guide you. And, the other thing is staying positive. We know that a positive attitude which with cancer, it is so hard to do, so hard to just, keep focused and keep that action plan going when you feel like your head's sinking below water. But there's people like you, Dr. Tan, there's people like us that are here to support people and reach out.
Yes, I thank you for that. Yes, the anticipatory griefs, many people don't realize the power of anticipatory grief and the power of being able to navigate anticipatory grief, which is the grief when something like this happening, and we are sometimes riddled with sometimes just have so many emotions, and that can cloud us from being able to think well too. But thank you so much for your amazing work, for your very honorable work that is so beautiful. It's much needed in this day and age for practically any major illness, and definitely cancers is on top of that. So thank you so much for your beautiful work, Rebecca. And for our audience, please share this information with your friends and family. Sometimes we don't know that a friend know someone who have cancer. In this day and age, cancer is so prevalent. And so please share this information with your friend and family, because just like ourselves, they want to thrive too, and we want them to thrive, all the people whom we care. And also, please share your gold nugget, 1 or 2 gold nugget in the comment below, so we can continue learning from each other and supporting each other to thrive. And this is Dr. Brigitte Tan, your grief specialist and founder of the International Childhood Cancer Charity. Thank you for joining us today, and I care about you very, very much, and I look forward to see you again very, very soon.